Good evening to you all. My name is Thomas Ryden. Been through quite a lot. Some call me a survivor.
For years, Thomas Nickel channeled his depression through his art and poetry. His creative talents became a mask for the emotional abuse he endured during elementary school.
And I remember kind of being tempted to just, just lie down in the snow and just lie there until, you freeze.
Thomas was in grade 6 and considered taking his life.
I just knew something was wrong, and so I came to my parents, and for the first time I told them that just take me to the hospital. I'm really not feeling well emotionally, and I think that was the first time I used the word depression around them.
Mental illness indirectly affects all Manitobans at some point, either through a family member, friend, or colleague. According to the Canadian Mental Health Association, 1 in every 5 Canadians will personally experience a mental health illness in their lifetime. The issue is also urgent for youth, where the total number of 12 to 19-year-olds at risk for developing depression is a staggering 3.2 million.
It is so important to start talking about mental health and mental illness because it can help decrease the stigmatization that is formed around it, where people feel isolated and alone and don't know where to go to get help.
Thomas was fortunate. He embraced counseling and started to educate himself about mental health by tapping into the innovative resources at the Mental Health Education Resource Centre of Manitoba.
This is so unique to Manitoba because we are the only library of its kind to be funded by Manitoba Health to exist solely with mental health related topics.
Thomas's family immediately noticed the positive impact of the Resource Centre.
I think a lot of parents were not aware of what our kids are all going through, and the more we can educate ourselves and the more we can become a part of what they're going through and kind of journey along with them is the key.
The Centre is a free provincial resource operated by the Manitoba Schizophrenia Society. It's a vast lending library complete with books, DVDs, training kits, audio resources, and archive files.
People can come here and find help, techniques, tools to apply in their own recovery story.
I thought I was alone. I didn't know where to go. I didn't know where to start.
Char McKay first learned of the Centre a few years ago while she was seeking help on how to cope with a partner who was diagnosed with obsessive-compulsive disorder.
My situation at that time was tumultuous, I guess you could say. It was very volatile. He would have explosions, and I felt like I was walking on eggshells.
She not only learned about the disorder, but also benefited from the staff's personal perspectives on mental health.
I've never felt judged by anyone here. Anytime I've needed help with anything, they've been right there.
Having lived experience with mental health, you can then relate better for the people that are walking through these doors, so you can have more empathy for them.
Get the help from an individual that has experienced it because they have a better understanding and they're more sensitive to your situation.
We provide a safe place for people to come, find information for themselves. We also have our new mobile app. It's our online catalog where you can search all the items we have online. You can place it on hold, come down later and pick it up.
The Centre encourages all Manitobans to raise awareness of positive mental health while reducing the stigma of mental illness.
I so support what the Centre is doing in regards to helping people dealing with or going through mental illness.
I think the Resource Centre does help to bring mental health into the forefront.
I'm not what I have done, I'm what I've overcome.